Lymphogranuloma venereum LGV is a sexually transmitted infection STI caused by certain strains of the bacterium Chlamydia trachomatis. It primarily affects the lymphatic system and can lead to significant complications if left untreated. LGV is relatively rare in many parts of the world but is more common in some areas, particularly among certain populations. Symptoms: LGV progresses through 3 stages, each with distinct symptoms. Primary stage: painless ulcer or lesion. The first sign is usually a small, painless ulcer or sore at the site of infection, typically in the genital or rectal area. This lesion may go unnoticed and often heals on its own within a few weeks. Secondary stage: lymphadenopathy, swelling of the lymph nodes, particularly in the groin or pelvis, which can become very painful. The swollen lymph nodes may form abscesses or buboes that can rupture and drain. Systemic symptoms: fever, malaise, and general illness. Tertiary stage if untreated. Chronic or late complications includes fibrosis, scarring, or strictures in the genital or rectal areas. In women, it can cause chronic pelvic pain and abnormal discharge. In men, it may lead to chronic urethritis or proctitis. Diagnosis: medical history and physical examination. Reviewing symptoms, sexual history, and a physical examination to identify characteristic signs. Laboratory tests: nucleic acid amplification tests and AATs for detecting Chlamydia trachomatis in genital or rectal specimens. Serological tests to detect antibodies against Chlamydia trachomatis. Swabs and cultures from the ulcer or lesion for direct bacterial detection. Imaging studies: ultrasound to assess swollen lymph nodes or abscesses. CT scan to evaluate more complex cases or to identify complications. Treatment: antibiotics. Doxycycline, the primary treatment for LGV, typically taken for 21 days. Alternative antibiotics: in cases where doxycycline is not suitable, options such as azithromycin or erythromycin may be used. Supportive care: pain management, analgesics to manage pain associated with swollen lymph nodes or abscesses. Drainage: in cases of large abscesses, surgical drainage may be necessary. Prevention: safe sex practices. Condom use: using condoms consistently and correctly to reduce the risk of STIs, including LGV. Regular STI testing, especially if you have multiple sexual partners or engage in high-risk behaviors. Partner notification and treatment: informing sexual partners if you are diagnosed with LGV so they can be tested and treated as well to prevent further transmission. Avoiding high-risk behaviors: reducing the number of sexual partners and practicing safer sex can help prevent LGV and other STIs. When to seek medical help if you experience symptoms such as genital or rectal ulcers, swollen lymph nodes, or unusual discharge. For routine STI screening if you are at risk or have had unprotected sexual contact. Conclusion: lymphogranuloma venereum is a serious but treatable STI. Early diagnosis and appropriate antibiotic treatment are crucial to managing the disease and preventing complications. Safe sex practices and regular STI testing are key to preventing LGV and maintaining sexual health. If you suspect you have LGV or are experiencing related symptoms, seek medical advice promptly.